Hi, everyone. Welcome to our webinar this afternoon, Does Work Location Matter? We're going to give it a couple more minutes for people to join. We're so glad that you're with us. If you'd like, stop and take a moment to put a note in chat about where you're joining us from. Otherwise, we're going to get going in about, a minute and a half, 2 minutes or so.
Yay, I see some people from Colorado. Hurrah!
Great to see people joining from all over.
Oh my goodness, Minneapolis.
Pittsburgh, Pennsylvania, near my hometown. Great to have you with us.
Thank you, Illinois. St. Paul.
I'll say today I'm in a beautiful sunny 75 degrees in Hanover, New Hampshire. Can't ask for better weather. Great to see Selinsgrove represented. Welcome, Kim, home to my alma mater, Susquehanna University. Wonderful to see Malawi on here. That's great. Welcome, everyone. We'll give it just a little bit more. So again, if you're just joining now, we're just welcoming everyone, giving everyone about another another few seconds here to join. And if you're just joining now, you can pop in where you're joining from in the chat. But we'll get going in just a moment. I see more people joining in the participant list, so we'll give them just a little bit more. All right. Well, I know it's a little bit after the hour. As other people join us, they're welcome to. We're going to go ahead and get started on a very exciting topic, and one that my co-presenters and I are very happy to have this conversation with you today. Our topic is, Does work location matter? Unpacking the data behind hybrid fundraising performance. Let's see. Just want to make a couple notes before we get going. If you have a question, you can see a Q&A box. Use that as a way to ask your question, and we'll be sure to address those questions as we go through through our conversation today. And also, just in case you have to jump off early, you're going to receive an email with a recording of this session within the next 24 hours. So no worries if you have to jump off for any reason. We'll start with some introductions. I'm Elizabeth Dahlhoff-Brown. I'm a consulting partner with BWF. I'm also the Vice President of Development at Dartmouth Health and the Geisel School of Medicine at Dartmouth College. I have two other co-presenters with me today who also collaborated with me on the research. I'd like to welcome Karen Arrested from the University of Illinois Urbana-Champaign, and Erica Dahlhoff, who's the Lilly Family School of Philanthropy. We're so glad to have both of them with me today, and they'll be also sharing our research with you. And I do want to answer the question many of you might have on your minds. Yes, Eric and I are sisters. So let's talk a little bit about what we're going to be covering today. We really want to talk about the rise of hybrid fundraising work and how we got to this place that has become much of a norm in our industry. We're going to talk about data telling us what really matters. We actually have spent a lot of time, the three of us, developing research and looking into this from an academic perspective, and we're anxious to share that with you. And lastly, after we get through some of the research and statistics, we're going to talk about what really matters. How do you not leverage this knowledge for success, especially if you're a fundraiser or a fundraising leader? So that's what we're going to cover today. I also briefly wanted to mention, really pleased to be doing this webinar today with the support of BWF. one of the reasons I'm a consulting partner with BWF is that they really understand the art and science of fundraising, and they really know how to customize solutions for every single client. And one of the reasons we really appreciate that is because by doing our research and understanding the facts and data behind what many of us have in terms of gut instincts, it really allows us to provide excellent advice and use that knowledge to improve our own fundraising. So thanks to BWF for hosting today's session. So starting off, does work location matter for fundraising success? This was something everyone was asking in 2021. Let's think back 4 years. In 2020, most of us found all of a sudden we were working remotely, and we were working remotely for most of that year of 2020 and into 2021. But as vaccines became more available, many of us in the fundraising industry found that our workplaces wanted us to come back in. They wanted us to be in the office. Sometimes it was a mandate for certain days of the week or a certain number of days. Sometimes workers did not want to do that, and there was resistance to being in the office. And Karen and I, as fundraising managers and leaders, questioned, well, what does the data say about this? We were all trying to make decisions based on anecdotes, not data. And we thought this was an important topic to study. Let's understand, does it matter if a fundraiser is forced to be in the office or if they have a hybrid work environment? So that's how we got started on this a couple of years ago. And then, hold on. Sorry, my slide is not advancing. There we go. We have a poll for you. Curious about your own work situation right now. Are you required to be in the office? And if you are, how many days a week are you supposed to be in the office? We'll give you a couple minutes to respond to this, and then we'll talk a little bit about what our research found on these topics. Just taking a look at this, Erica and Karen, I think the results are really interesting. We're finding more people are required to be in the office, that is something that people are expected to do. But I think in the early results here, it looks like not 5 days a week. Only 17% of people have that.
And that's pretty consistent with the results that we saw in our surveys too. We started thinking that we were going to be talking about 3 different distinct groups, which was remote and fully in person and hybrid, and that shifted during the course of the research.
That's right.
Mhm.
So this is really interesting to see this, and I want to thank everyone for to weighing in on this. I think the results kind of bear out what we heard. Would you agree, Erica?
Yes, a lot of this looks consistent with what we've found in the data, and I'm so excited to share that with you in a few more slides.
That's great. So let's see. Talking a little bit more about what we find today. You know, we just heard from all of you about your situation. Someone's even jumping into the chat saying effective in September, 5 days a week in the office will be required. Well, you might want to share some of this study with them for those of you who are in that situation. As a fundraising leader, there's 4 factors that really influence how we're managing and how we're sort of having people in the office or out of the office these days. One is that more and more candidates for positions as fundraisers are have some sort of level of expectation of having hybrid or remote work. I think a very common question I get when talking with candidates is, well, you know, do I have the option to work remotely? Can I travel and have an opportunity to work from wherever I am? That's more and more of an expectation in our field. We also have a number of nonprofits facing difficult budgets. There's a lot of concerns in higher education, healthcare, and many other parts of our industry around funding issues for a whole variety of reasons. And so philanthropy tends to be one of those places that many institutions turn to support the budget in difficult times. I would say, in addition to sort of knowing that fundraisers are looking for remote options. We also know it's hard to hire fundraisers. It's a tight market. There's not as many people looking for jobs as there are positions available. And so we have to sometimes think about ways that we can attract and retain fundraisers. And lastly, managing people in a hybrid environment is different. We're going to talk a little bit about that in terms of the impacts and things that we need to think about. But hybrid work and how you manage hybrid work requires a different skill set than managing people who are in the office every day. So this is a bit of the fundraising management landscape today. And I know Erica's going to tell us a little bit around sort of the overall view of fundraising and what we're taking a look at in those trends today.
Yes, thank you, Elizabeth. So before we get into our specific study, I wanted to share a little bit about the overall giving landscape currently. So I wanted to share some data from the most recent Giving USA report that just came out in June. And also I wanted to share my gratitude for BWF for their sponsorship of Giving USA, the Giving Foundation that supports this research. So in 2024, charitable giving totaled nearly $600 billion. And this has actually been increasing. It increased between 2023 and 2024, even after adjusting for inflation. Though I would note that this is still lower than it was in 2021 in inflation-adjusted dollars. That continues to be the best giving year on record, in part due to a lot of giving that was related to COVID. Individuals are the main source of giving in the US. 66% of giving came from individuals. And I would note that this is not necessarily true in every country around the world, but in the US, giving tends to come from individuals primarily. And then I wanted to share a little bit about the health sector, since we're focusing on academic medical centers in this study. Giving to health continues to increase. It had a robust increase from 2022 to 2024, which was 8.1% after being adjusted for inflation. And for comparison, in a couple of other sectors, education in that time increased by 3.9%, and human services increased by 0.4%. So part of what inspired this study, as Elizabeth mentioned, is that there was a need for data about some of these questions that were arising around hybrid work, and not just relying on anecdotes or gut feelings, but actually seeing if we put this in a model, what will the results tell us? So we designed a study that's focusing on fiscal year 2023 data, and we collected data from 7 academic medical centers that generously shared their fundraising data with us. And so we're looking specifically at the work of 200 gift officers. And we ran this actually as an academic study. So we received IRB approval to do the study, and we're currently seeking publication in a peer-reviewed journal of an academic article that we're writing. So first, let me tell you a little bit about the study design. So to understand the impact of fundraising on, or the impact of your work location on fundraising, we focused on 4 different outcomes. So you'll see that in column 3. So we basically developed 4 models, and we looked at the impact of the items in column number 1 and number 2 on number 3. So we were focused on seeing the results for contacts, solicitations, gifts closed, and dollars raised. So this is data that we had from all of the gift officers in our study. And we were primarily focused on 3 major predictors. So the number of years at the institution for each of these gift officers, and then some work requirement related things. So first, whether or not gift officers in that department were required to be in the office. And then number 2, the average number of days per week someone was in the, the staff was generally in the office. That's actually a staff-wide measure. And then we had a couple of controls, which are basically things that could influence the outcomes that are not directly related to our study questions, but were important to control for, such as the age of your institution and the size of your hospital endowment. So just to give you a sense of what the data looks like that we collected, here's some of our descriptive statistics. So we have basically the average in the middle for each of these numbers as reported, and I'll highlight two of these. First, years at institution. The mean was 8.2 years, the median was 7 years. So this tells us that your average gift officer in this study had some experience at the institution, and of course there was a range of experience. But generally, people had been there not quite a decade, but certainly more than like 5 or 6 years. And then the other thing I would note is I know you just answered some survey questions about this, but the estimated average days that staff is in the office per week tended to be between about 2 to 3 days per week. So I think a lot of your answers clustered around that. So that is also consistent with what we were finding in this study. So with all this data that we collected, we then um, designed some models to test this. And so if you really love statistics, I will share that I used a negative binomial regression model, which basically means that usually when you're running models, you like your data to have a nice even distribution, which this data actually did not. It actually tends to cluster to one side of or the other of a distribution. So this kind of controls for some of that uneven distribution. We also clustered our analyses by organization. So basically, you're controlling for the fact that there are 7 different groups of people and in each of these groups, all these people were working in the same organization. And then finally, I'll note that we did drop individuals with less than 1 year of experience from the model, in part because we only had partial year data from them. And then also, I would note that we assume that your first year fundraising someplace is probably a little bit different than every subsequent year you're at a location, so we did not include those people in our model.
That's great, Erica. I know we had a question in Q&A, and maybe to clarify for folks, someone asked, are contacts as we defined them just contacts or are they visits? And I don't know if you and Karen would like to address that.
Yes, these were more substantive contacts, so we did include virtual outreach. And this is in line with where most organizations were shifting post-COVID to including some kind of interaction that was bi-directional with donors as a means for assessing the interaction that happened with those relationships.
That's right. So, like I think many institutions went to, it's face to face, but that could be also a phone call. It could be a Zoom meeting. We accepted all forms of that, but not just an email.
So we've now talked a little bit about the data. We've talked about the models that we've used with that data. So now we're going to talk a little bit about the results. So we wanted to know a few things. So in particular, are the number of days you spend in the office each week associated with more meaningful contacts, more solicitations, more gifts closed? And perhaps most importantly, I think the key question that everybody really wanted to know was what variables are associated with dollars raised? Because that's really at the heart of what's being done in fundraising. So I think, though, before we're going to tell you the answers, we have another poll because we're curious to know what you think and what you think might have predicted dollars raised. It was really fun running these models because I also wanted to know the answer. And I know every time I met with Elizabeth and Karen as we worked on this study, that was always the big reveal of what our data was showing.
Yeah, that's so true. I think Karen and I often couldn't wait to talk to Erica as she was running these various models. And as you're going to see in some of our results, they were a bit counterintuitive or maybe not quite meeting some of the anecdotal and gut instincts that I think many fundraisers have had over the years. So just looking at the results, we have quite a few people, 75% of folks have participated. Most people think the tenure of the gift officer is the biggest predictor, but we also have some interest in the age of institution, and there is some interest in the average in sort of thought around average number of days in the office or required to be in the office. So good to see this. Let's take a look and see what we found in our data and how that worked out. So here we go.
Yeah, so there was actually only of our major predictors, only one was important for dollars raised, which was the gift officer's tenure at the institution. Both the requirements to be in the office and the number of days a week the staff was in the office had no significant effect on the dollars raised ultimately. So that was, that was really interesting findings, and I think really speaks to, whether it was important or not for people to be required to be in the office and being required to be in the office for a certain number of days.
That's right. And I think this is something, Karen, that we kind of knew intuitively. We knew that if the longer a fundraiser is with an institution, they tend to raise more money. But it was nice to see that data borne out, or that assumption borne out in the data.
And it was consistent with some research that Johns Hopkins did a few years ago, particularly for the Medical Philanthropy Institute on what are those predictors related to fundraising. And this is the only one in that study that was consistent as well, is the relationship between the tenure of the development officer and the institution's dollars raised.
Yeah. And before we go on to some of our key findings and the implications for those, there's another question in the chat. Diana was wondering, did you look at other duties such as having direct reports? Diana, we actually did not gather data on whether a fundraiser was also a manager or perhaps had other responsibilities. One of the things I'll share in doing this project, I think we learned a lot about frankly, how difficult it is to get data. As we talk with institutions, we were really grateful to the 7 institutions that participated, but getting sort of detailed level data like that was a bit of a challenge. So we tried to keep it a bit more high level. But as we'll talk about at the end, there's a lot of opportunity for continued research. And that's an interesting question that one of the questions, many questions that we're taking a look at. So we're going to take a look at some of our key findings. The first one here that we learned in all of the models that Erica was talking about is that more days a week in the office was associated with a larger number of meaningful contacts. So that means if you were in the office more, you were having more meaningful contacts. So that was one key finding that we had from this.
I'm just going to interject here for a second, because I think the first time that we saw this, we were like, what? That doesn't make any sense. And we'll look a little deeper, and I'll talk about it at the end when we look at what does this mean.
Yeah. And I should say too, feel free to jump in chat and share your reactions to these, because some of them I think go against some of the accepted wisdom in our fundraising field. So if there's one of these that you're like, I didn't expect that, please share it, because you're probably not the only one who feels that way. The next one, but more days in the office was associated with fewer solicitations and fewer gifts closed. So this was really taking a look at you might have more contacts, but you actually weren't making more asks. This is one of the things that we learned from this. Another key finding, requiring gift officers to be in the office at set times increased contacts and solicitations, but had no effect on closes. So I think in 2021, we started to hear some fundraising leaders say, we have to require people in the office because we're just not going to be able to close gifts otherwise. And I think what we found is that you might have more contacts and you're not going to necessarily close more gifts, though. This one was interesting. The number of days a week in the office and requirements to be in the office had no effect on dollars raised. So I'm going to say that again. When you're required to be in the office and you have a certain number of days you have to be in the office, it didn't affect your fundraising. That one I think was interesting. And lastly, more institutional experience was associated with more dollars raised, which is what we noted earlier. So those were the key findings we had after running all of our statistical analysis. And really, for us, Karen and I especially, we were really excited to see these results, but really mattered is how they affected us as managers. How do we use this as fundraising leaders? And Karen, and I know you and I had a lot of conversations as we talked about this data with Erica about how we were going to apply it to our work.
And this came from conversations with other development managers about what does this mean from a perspective of retention, of trying to hire, of adapting our technology to a new way of working, and what does that mean for management? I'm going to take a second here and just distinguish between autonomy and flexibility because it's going to come up in a second. What we defined as autonomy is the ability to make independent decisions about your own work versus having the employer making those choices for you, number of days in the office, specific days in the office. And what we saw was that more autonomy led to more happiness. We're going to see this in a second, and there's other results that bear that out. The other is flexibility and having a range of choices and being able to decide for yourself where you work and when you work. Sometimes that's possible in certain roles, sometimes that's not. If you're going to be working with a physician, you're going to have to figure out how to time that in a way that's going to be most applicable to their work. But I think it's important to think about, especially as we get people who have had a longer tenure, their expectation for both autonomy and flexibility gets higher the longer they're in their roles. And there again is research to back that up.
Yeah. And Karen, I'm just going to note before you go on that we do have a couple questions in chat. We're going to answer a couple of them in chat. There's a couple that I think we're going to take at the end, just because some of what you're going to talk about will speak to those questions. So feel free to keep questions going in the Q&A, and we'll address a lot of them at the end. All right. So Karen, okay.
Should I jump into the specifics of each of these?
Yeah, I'm going to move to the next slide. First, talk about autonomy.
Yep. So the data showed generally that fundraisers who are experienced can be effective anywhere. I think we intuitively knew this because many of our fundraisers have been doing hybrid work longer than hybrid work was trendy. You know, they were working out of hotel rooms, they were working in coffee shops as they were getting ready to do their next meeting with a donor. So this was not as big of a shift for some of our development officers as maybe it was for other industries. As I mentioned earlier too, there is research that shows generally employees are more happy with more autonomy. This lines up with the HR status, the sociology of independence in your own capacity to manage your workload. And that wasn't a huge surprise, but it was interesting to see that borne out in the data that we looked at. Autonomy really is about having the independence to make your own choices. And I think we see a level of self-direction expected of our more senior gift officers. And it does make sense that this would be an expectation. And those gift officers with more experience tend to raise more money. So we need to keep them. I think we can go to the next one. It's just more about the flexibility side of that. I think somebody mentioned earlier, autonomy and flexibility both kind of line up with trust. And I think that's a great point to mention here. I think all those things are intertwined. We were trying to, in as much as we could, separate those out so we could get at the real drivers of some of these things. But I think underneath it, it is about how do we interact between employees and employers in this new environment that we're operating in. Flexible work offers options for recruitment and retention that we didn't have in the same way pre-COVID. We're seeing a lot more major gift officers who don't even work in the same state where their organization is operating. I know, Elizabeth, you have people who live in other areas that are within driving distance, especially in the Northeast. You can do that kind of thing. It's a little harder on some places in the West. But we are seeing a lot more of that, and it's effective. If we are where the donors are, or we are where we can get to the people that we need to get to be in person, that's just as effective these days in how we interact. And that also means that geography doesn't have to limit our pool of fundraisers. we used to have to consider, what is it going to take to be able to offer a package that's going to encourage somebody to move from Southern California to, New Mexico. And that may not be as much of an issue anymore. That's going to depend on the job. It's going to depend on the need for interaction with whatever faculty partners. This offer a lot both to the employer and the employee. And what we're also seeing is we're getting more time out of employees. They're not having to deal with some of the long commutes and the challenges in being able to get away for a kid's soccer game or whatever and come back. So we're able to get a little bit more out of some of the options that we're offering to our development officers these days. Want to speak to that a little bit here, Elizabeth? Because I think you're seeing that too.
Yeah, and one of the things that we live in a fairly remote part of New England. Decent sized airports are at least an hour and a half to 2.5 hours away. And so for us, it's been really interesting to hire fundraisers who actually live closer to a good airport and not so much closer to us. It's really thinking about the position and thinking about the right geography for that position, being flexible in our thinking, and also being really clear about our expectations for when they do need to be in the office. But for us, and at the end, I'll probably share a little bit around how we're doing it based on our research. But we're finding there are ways that we can be flexible and really make it work for both the fundraiser as well as us.
Great. You want to go on to the next one?
Yeah.
Technology matters. I think we all saw this during the pandemic where, the screen was going like this, or people were saying, "Hey, can you hear me? Am I muted?" It matters. So our investment in technology to allow our fundraisers to be efficient and effective in their work is hugely impactful, especially as we look into more remote options and how we interact with donors, because it presents not just on the employee, but on the employer as well. Also, we see that donors are more receptive to having virtual options. I remember, 2019, no one would have taken a virtual meeting, especially not with a faculty member. They wanted to be in front of them. They wanted to have that interaction that was meaningful to the donor. And I think what we've seen is an openness now to look at virtual interactions in very similar ways to how we had face-to-face discussions prior, but it's not the same. I think there is something to be said about having a face-to-face interaction in the early days of getting to know a donor, where you can maybe move on to more virtual interactions later. So as managers, we need to be thoughtful about that and not make assumptions that all first interactions can be virtual, because you can get body language and different things out of those conversations that you can't get in a virtual environment. So these are the kinds of things that we need to be thinking about as we're looking at modeling and doing our work in this new hybrid operation. I think we also just need to be thoughtful about maximizing our time. The fact that we maybe don't need to spend as much of our leadership time in airports or on planes or coordinating 4 different people to be able to go to a different state for a 1-hour meeting, that opens up a lot of options and opens out a budget for different uses if we think about it from a different perspective. So the confidence of our donors and the confidence of our employees matters in this situation. And so technology is a big part of that. Mentorship matters. I think this comes back a lot to the piece about recruitment, retention, and how we start to build out a longitudinal plan for our development officers. We intentionally removed those who had been in their positions for under a year, primarily because we couldn't make comparisons between someone who had been in their role for 4 months versus someone who had been in it for a year. But also because it's very hard to be productive in your first year in any job. So we needed to be really thoughtful about that. But it does bring to mind, what does that mean for how we onboard new development officers, and particularly those who are newer in their careers, because they don't have the same options to be able to listen in to the stories that they're going to hear from their colleagues at the water cooler. And how do we start to layer in some intentional mentoring and shadowing and options to be reflective between their managers and employees, and do a little of the reviews and sort of autopsies after a conversation so that people can learn and grow in their various gift discussions, whether in person or not. So this is going to change what we lay out from the beginning in terms of bringing on new development officers and more experienced development officers, and we need to be thoughtful about that. I will give a shout out to Illinois that has been very conscious of what this has looked like over the last number of years, and I think probably in some ways similar to Elizabeth, because it's in an area that is less close to a large urban metropolitan. We needed to be really thoughtful about how we retain employees, and they've done a good job. I'll go on to the last one, which is about retention. And I think everybody will probably note that we have a long retention rate in the average for the study that we did. 7 years in any position is pretty long. And I was surprised by that. I think there is a tendency, particularly within academic medicine, for people to stay for a longer period of time. Once you're in it, it's kind of hard to leave. It's a fun space to be in, and it's a unique cohort of people who find themselves drawn to this work. But I think there's some really important things that we need to be thoughtful about based on what we saw here, given that the only real association between dollars raised and any of those variables that we looked at was institutional experience. So keeping people, helping them grow, helping them feel that they're part of a much larger narrative with your institution is really important. And developing career paths that give people the ability to have the autonomy and flexibility that we talked about early on in these decisions is going to be important in terms of retaining our talent. So I think those are the key things that came out, and the key issues that we wanted to make sure were addressed from a management perspective.
Oops.
But I'd love to hear questions.
Sorry. Yeah, and actually we had a couple pop up in the Q&A. So how about I go through some of these, just as we're here. We had a question about what we're considering on site. Just recognizing that a lot of gift officers work. I like to say gift officers were the original hybrid workers because they've been working in coffee shops, airports, hotels for as long as we've had fundraisers, I think. I think in our study, we've really looked at whether they were required to be at what would be considered the office, or in some cases, the medical school or the hospital. So whatever sort of the organization is, that's what we considered on site. We really weren't counting that time that we were spending, that many of us spend in other alternative locations.
And going back to the original kind of layout of the research design, we dug into every policy of the 7 institutions that we were working with to make sure that we were consistent in how we looked at that and compared the different policies across organizations.
Mm-hmm. I think Katie's asking, do you see an argument with your last key finding that more in-office experience will make them more effective fundraisers? Katie, from what we're seeing, more experience helps them raise more money. I think what Karen was getting to around mentorship really matters, though. I think we do know that mentorship is really important in fundraising success. That's not something we were able to quantify through this study, but I think that mentorship might happen in the office, it might happen on Zoom, it might happen in other locations. But what's really important is that places are intentional and thoughtful about how they can help build effective fundraisers. Karen and Erica, I don't know if you'd want to comment on that, but.
I wanted to jump in with a question that came from one of the study participants. Does it matter in terms of longer term leadership opportunities? Because I do think having a mentor that you get to interact with on a more regular basis does matter in terms of growing within the organization if leadership and administrative management is a long-term goal of a development officer. So that is something to keep in mind. And I was thinking about this both in terms of the experience of the mentor, but also the experience of newer people coming in, because those automatic opportunities are less frequent now. So they do need to be intentional, and we need to make sure that our newer professionals have the opportunity to learn from our more experienced folks.
Mhm. There's a question from Alexander about, did we look at where development advancement program reports? Sounds like he's at Rush in Chicago. The chief development officer is a member of the board of trustees. We did not
We didn't
look at
no.
that. That was not, we were able to capture. And I like this question. Based on your research, any thoughts around performance for non-gift officer hybrid performance, such as database managers? Great question. I definitely have thoughts on this. Karen or Erica, either of you want to take it?
Sorry, I just need to think about the question. Thoughts around performance of non-gift officer hybrid performance. You go ahead, because I don't know that I completely understand the question.
I'm thinking it all comes down to autonomy. I think that this is actually when we started to look at the research, the literature about autonomy and how that relates to job satisfaction and happiness. It is a strong correlation no matter what kind of job you're looking at. So I am a big proponent of really giving your employees as much autonomy as you can allow, because I think that really makes a difference. Erica, do you want to comment on that at all from your perspective?
Yeah, I would agree. From, while we did not look at non-gift officers, I would anticipate that we would also see that performance I would not, I guess I would not imagine it's related to being required to be in the office or days a week in the office. I imagine it probably probably has more to do with experience. And also, I agree that most of the studies we've looked at have suggested that having autonomy and flexibility and really getting to work in the way that works the best for you tends to make people happier and more productive.
That's right.
Interject, there is some distinction in terms of the job itself and whether or not there is an in-person component that goes to that position. There's some great research by Linda Grattan on whether or not things can be done asynchronously or not. So if you do need to work in a team, it's much more challenging to be able to do that from a remote environment because of the interaction that needs to happen sometimes in order for things to be able to progress quickly. I think one of the benefits of being a development officer is often you can have independence, where in some roles that's not possible as much.
Mm-hmm. And then a last question here from Stephanie. There's some nuance here, but when talking about hiring fundraisers remotely, is there any research on the efficiency of hiring them in market where the donors are versus not in market? For an example, hiring a fundraiser to cover Texas, who's located in LA versus hiring a fundraiser in Texas. That's a great question, Stephanie. I don't know that I've seen research on that. Erica or Karen?
I haven't seen research in that area, but it's a great thing to look into. And I think we'll have more options now that there is more opportunity for people to work out of state from where they're.
That's right. And I actually think this is one of the reasons why we were inspired to do this research. Karen and I met through the Johns Hopkins Medical Philanthropy Institute, and one of the messages that they really share is the importance of actually developing primary research in our field and doing studies like this, so that we're not just doing data based on a bunch of sort of gut feelings that a lot of people might have. We're actually looking at what we can learn from statistics and primary research. And I would say you're asking a lot of really great questions. And these are things that probably haven't been actually studied in our industry, but it is something we encourage people. If you're ever interested in figuring out how to do one of these studies yourself, we're happy to talk to anyone. We learned a lot in doing it, and are happy to share that information with you. So this is some really great chat sort of in the webinar around remote workers, kind of productivity. A lot of people are saying they're finding they're more productive at home, which I think I can understand. So I'm just going to check Q&A once more. I think we're all set with. Oh, go ahead, Karen.
One more comment that I remember looking at the first results that we got from Erica of the statistics and discovering that there was an association between the amount of time in the office and the amount of meaningful contacts with donors. And to me, that was a surprise. And having talked to a few folks, my guess is, we don't have data to bear this out, but I think it's a reasonable guess, is that when people have more time in the office and they're not meeting with donors, they have more time to document the things that they did when they weren't in the office. Which to me starts to raise the question, are we measuring the right things? We always talk about metrics and how do we make sure that we're getting to the outcomes that we're aiming for? And seeing results like that just to me was interesting about what does that mean for what our metrics maybe should be. And thank you, Michelle, for the shout out to Johns Hopkins.
Carrie's asking, were all of the 7 institutions hybrid work environments pre-COVID? I don't believe so. No.
No, I think they
No,
were
that
all
was
in.
new. Mm-hmm. So, okay. Well, it's really great to have these questions. Feel free to reach out to any of us afterwards as well. To wrap us up, just a couple of things here. We do have a poll. I think this research raises a lot of questions, and we're just curious to hear from you. Are there some topics that you're after this you're actually wondering about? So do you want to learn more about metrics and best practices around metrics? Managing a hybrid fundraising team, it's something I think about every day. I am working from home today, but some days I'm in the office. Same is true for my team. So how do we be successful? And I think, kind of the classic question, how do we make sure that we increase fundraiser performance? How do we do that in an effective way that also takes into account basically how can we support them in that no matter where they're working from? So really appreciate your feedback on this one. And it might be part of what gets us excited about some new research. I don't know. That's
And
great.
if you're asked to participate in research, please seriously consider it. It does make a difference in our field, and it gives us the grounding and evidence that I think a lot of our faculty are looking for in terms of their partnerships with us.
That's true. Yeah, we really are grateful to those 7 institutions. We promised we'd keep them confidential, but if you're out there, thank you. It really mattered. So, yeah, thank you. All right. Well, up next, I just want to highlight an upcoming webinar coming up in August. We have your campaign launched big. Now what? This is a really important one, I think, especially as many campaigns are assessing what's happening in the larger environment economically and with their donor base. So really excited to participate in this one coming up with Carol and Megan from Riley Children's Hospital. So put that on your calendars. If you'd like to sign up, there's a QR code there for you. At this point, we just want to say thank you for joining us today. Really appreciate your interest in this. Please do feel free to follow up with any of us. Our emails are on the screen. We'd love to have your questions that might inspire our next research study. So thank you so much for participating.
And have a great day.
Thank you, everyone.